So good morning to all of you. My name is Ron Hollander. I'm the Executive Director of the Caring for Carcinoid Foundation, and I am so glad to welcome you all here today. Pam, Kunz, and I from Stanford are going to offer you some opening remarks, and then we're going to get right into today's agenda. I want to first welcome all the patients, families, caregivers, 250 of you here in the room with us here today from, I understand from talking to people last night and this morning, New York, New Jersey, Colorado, Washington State, Wisconsin, Texas, all over the United States. So welcome to all of you, especially those of you who've come so far to be with us here today. I also want to thank the many, many people who are joining us on the live streaming here today. I think some of you know I am a member of the board of the International Neuroendocrine Cancer Alliance. And I understand from my colleagues that we are being joined today with colleagues from the UK, Canada, Australia. Good morning, Australia. It's 5 in the morning Monday in Australia, and throughout Europe and the Far East. It's really, really a special, special day, a special program, the day after Rare Disease Day, as many of you know, to be together. So welcome to all. I also want to start with some thank yous. First to Stanford for being such wonderful partners. This is the 4th time we have done this conference together. It just gets better and better every year. Pam Kunz, my co-chair here today, has just done a spectacular job, as she always does, working with the outstanding faculty, George Fisher, and all the others you're going to hear from today. It's just a very special treat for us to work with them. So such collaborative and leadership thought leaders in the whole field of neuroendocrine treatment and research. I also want to thank our collaborators here today, UCSF neuroendocrine specialists who are not only populating throughout the day our program, but have also been wonderful collaborators throughout the year. We do, as I believe you know, and you can see outside in our display, a lot of very leading research at both of these institutions here in Northern California. And it's a special treat for us to be working with them here today. And also the Northern California Carcinoid group that have always been wonderful collaborators on these education programs throughout the year. Josh Mailman, their leader, and many, many of you from that group that I've met here today as well. So final special thank yous to 2 important groups. One, our sponsors. As you know, we make these conferences available free of charge to all of our patients and families and caregivers. We couldn't do that without the very special support of our sponsors, Ipsen Pharmaceuticals and Net Alliance. So very, very special thanks to them as well. As I said at the outset, I'm the Executive Director of the Caring for Carcinoid Foundation. I've had the privilege of really being in that role now for 3 years. I speak to patients and families every day, and I hear over and over and over again the all too familiar story that was the story of our founder almost 10 years ago. Late diagnosis. When finally diagnosed, finding that the caregivers you turn to most often know very little about the disease. And when you do the research, you find information that is sometimes not all that accessible, sometimes conflicting, not as reliable as you'd like. And the frustration of not finding more standardized treatments, effective treatments, and most of all, cures. So we are here to fill those needs. We are here today to really provide you with the kind of current and emerging information about clinical treatments, about the exciting information about what's happening on the research front that gives us real hope for improvements in treatments and cures, and very importantly, strategies, information about living with neuroendocrine tumors and managing the disease effectively, because so many of you have been on that journey, and it is a journey for many, many years. So our hope is that through this program, which Pam will now describe to you, that we will provide you with and empower you with information, resources, and we also hope connections to the speakers, but also connections to each other, because that's a vital, vital part of being a part of this neuroendocrine community that we at the Caring for Carcinoid Foundation are so privileged to be part of. So without any further ado, let me turn it over to our co-chair, Pam Kunz, and please join me in a round of applause for Pam.
Thank you, everybody. Thank you all for coming and spending your Sunday with us. We appreciate you taking the time out of your day and travels, and we have a very exciting day planned. I'd like to just go through the agenda a little bit, give you a preview of what's to come for today. I'd like to encourage you to be interactive, ask questions, introduce yourselves to your neighbors, and we really want this to be a very interactive meeting today. So we will start off, Dr. Fisher will start off with an overview of NETs. We know that patients come today in a very different stage of their journey. Some are newly diagnosed, some have been living with NETs for many years. Patients come with different primary sites, so George will give us a little overview of NETs. We will then go into one of our key sessions for the day on immunotherapy, and we hope to impart some hope and optimism about new treatments. And George and I will both be speaking at that. We bring back also an old favorite, Greta McHare, the dietitian from UCSF, who always gives a wonderful talk on nutrition. We will break for lunch. We will be having lunch outside in our beautiful California weather, and faculty will be around, so I'd please encourage you to speak to faculty during lunch as well. We'll then go into our afternoon session. We have a great talk on making sense of information on the web, really trying to help guide patients to trustworthy websites and learn how to use the web to find out information about a rare disease. We will then speak about advances in NET treatment. We have three great speakers. Dr. Brendan Visser from Stanford will speak about surgical advances. Dr. Arthur Sung is an interventional pulmonary doctor. Will speak about lung NETs. And Dr. Emily Bergson will speak about advances in medical oncology. And we'll then have a break. We have some great posters out there. This will be an opportunity for you to speak to some of the researchers and our research staff about some of the research both here and in other places. That poster session will be available also at the end of the day. Then our last two sessions, we have a great session dedicated, it's very patient-centric, talking about living with NETs, during which we will have a patient speak, Carrie Brentro from NANETS. We will talk about stress management in cancer care, integrating Eastern and Western approaches to managing symptoms, and then talking about NET survivorship. And then we will finish the day with a panel of the majority of our speakers will stay till the end of the day, and this is really your chance to ask questions. We encourage questions throughout the day. We will dedicate a few minutes after each session to questions, but please write them down on index cards. We'll have microphones up for you to ask questions, but this last session at the end of the day will be a way to ask the panel of experts your questions.